I'm pretty transparent when I talk to students and colleagues about the fact that I have experienced depression.
We're often asked to work longer hours and see sadder and more difficult things.
I know from my own experience, it's very easy to get fatigued, to experience burnout, to have challenges of the stresses and stressors of patient care and clinical practice.
The first step is understanding that you're not alone.
As much as things have changed over the years, there is still a unfair, unreasonable stigma when it comes to physicians experiencing mental illness, talking about mental illness, receiving treatment for it.
Unfortunately, as healthcare practitioners, we have an increased risk of self-harm, substance abuse, and suicide. And it's important that we all recognize the incredible amount of pressure that we experience as healthcare professionals.
Estimates suggest that approximately 300 to 400 physicians die by suicide in the U.S. each year. That is approximately one physician per day.
Being a physician is one of the most rewarding and also challenging jobs I think anyone can have.
I feel really, really lucky because I was raised in a family that was open to this idea of seeking help when it's necessary, especially mental health help.
We simply know that talking about it and sharing openly and receiving help makes a difference.
Workplace stress, burnouts, and mental health stigma are just a few of the contributing factors to this growing crisis.
Although our training prepares us mentally for the right decisions, often the emotional components of it are not as apparent.
Mental, emotional challenges that come with the job are immense. We think about the school and everything you have to know and the stress of running around the hospital. The mental component of this job is really intense.
The amount of stress it takes on ourselves, on our patients, on our family, and on our friends. And it's important as medical professionals who continually offer help to patients to recognize that we are also patients ourselves.
In medicine, a lot of times we focus on taking care of others as opposed to taking care of ourselves. And an important goal of this month and of this message is that it's okay to admit that you're having trouble, that you're tired, that you're burnt out, and that you need some help or you need some time.
Experiencing shame, contributing to shame, hiding, denying, contributes to burnout and makes things worse and makes us lose physicians and medical students every single year to burnout or suicide or other effects that could be prevented.
Medical students have rates of depression of approximately 15 to 30% higher than the average population.
Some people get into this field and they get to a certain point and they feel like, I can't do this. Having encouragement from peers as well as their professors is very valuable.
When you feel stuck, it's really, really important to practice self-awareness and to get help. And I'm not really fond of suffering, and I was lucky early on to discover that, in fact, seeking help and therapy, medication if it's necessary, it is a way clear and out of suffering.
Our campus is trying to do what it can to really not just tell students, but model for students.
As a physician, I think a lot of us may think we can get through it, push through it like we do with so many other aspects of our job, but it is something that we really should not do. It's not something we would advise patients to do, and one of the things I always think to myself is, what kind of advice would I give a patient?
Providers need to be more aware of their own behavioral status and how it can be affected by events in the world, the hospital, and those around them. Sometimes it's a thankless job, and you can find yourself quite dysphoric.
We're trying to destigmatize some of these stressors that we all experience in the practice of medicine.
Sometimes we see some really, really bad stuff, things that we unfortunately may take home with us. It is really important that we if we can, seek some sort of help, whether it be our village or professionally, to make sure that it's not taking away from our ability to provide care to the next person that needs us.
If they do have feelings of despair, reach out to somebody so that we can help them.
Most people that work in medical professions are extremely driven and hardworking, but also that comes with the inability or the lack of desire to reach out for help, because it may mean having to admit that we are not okay, that our mental health is not okay, and that we need help.
Doctors are people first, and people can get depressed. And depression is a real condition, and depression really needs to be treated.
If there's any message I want to give to colleagues and particularly students early on, is this job that we do is incredibly hard. It's not accidental that medical school is set up the way it is. It's incredibly difficult for most people. It's the most difficult thing they've ever had to do. And that's not an accident. It helps to prepare us.
If you're a provider and your soul is bleeding, I would ask you to take as much care of yourself in that regard as you do with everything else.
It can be hard to ask for help, particularly when we're all programmed to take care of others, but if the healer can't heal themselves, then they can't help others.
Being a physician, working in the medical field, is one of the hardest jobs in the world, but it's also one of the most rewarding jobs in the world. When you save a life or even just connect with a patient who values you, there's no greater feeling. So this journey is worth it, but you just have to realize you're not alone, and it is very difficult, but it is very rewarding, and we are here for you. You have people that are here for you and will help you get through this so you can reach your ultimate goal.
Seeking help for your mental health is a sign of strength.
Tune in to yourself, figure out where you stand today, and if things are tough, reach out and get help. I don't know if there's anything else to say about that.